Okay, everybody, welcome to our first session of the day. In today's session, we'll be focusing very broadly on the issue of exacerbating inequalities. So we're going to kick it off with a talk by Ryan Parsons entitled Business as Usual, Poverty, Education, and Economic Life Amidst the Pandemic. We'll then hear from Matthew Skinta and Angela Sun on the impact of COVID-19 on the lives of sexual and gender minority people, and then from Kristen Desjarlais-deKlerk on housing as healthcare, mitigations of homelessness during a pandemic. So, so the way this will work is the presenters will give our presentations in order, and then when all the presentations are done, we will open it up to the audience for discussion and question and answer. So I'm going to I'm going to disable the chat while the presenters are speaking so as not to distract, and then I'll turn it back on for the question and answer and discussion. So if you have a question at that time, you feel free to type it into the chat, message me directly, or raise your hand. So without further ado, Ryan, we'll turn it over to you.
Great. So I am currently in Mississippi in the United States where it is the morning. So good morning, if that is relevant or accurate for you, or good evening, good afternoon. So my talk today is based on some follow-up work in progress. Can everybody see my screen, or is it in presentation mode?
We can see it.
Okay, great. Yeah, so this is kind of ongoing follow-up work to the piece I published in the edited volume. It's going to be a pretty casual talk since this is, work in progress, and it's also going to be very local. As Michael mentioned, this is based on research in a kind of predominantly African-American or Black small town in the American South. And so I'm going to talk a bit about the context and then conclude with some thoughts and provocations about how this might be relevant or useful for analysis in other parts of the world. So this is based on ethnographic work in Sunflower County in the Mississippi Delta, which is highlighted here in red. So the Mississippi Delta is one of the United States' most impoverished and most rural regions. It's a predominantly Black county, very high poverty rate, and relatively low rates of educational attainment. And so before COVID-19, I moved down to do my field work in 2018. This is already a very vulnerable and disadvantaged community. And COVID-19, of course, has only made that worse. Just to give some context about how the pandemic has played out here, this is the case rate per 100,000 people. And so, the pandemic really started globally, in March, February, but the local sort of peaks here were in the summer and then over sort of the holiday winter season, or the North American winter season. By comparison, Sunflower County, where I've focused, was a bit worse in terms of these per capita measures. So very high peaks in the summer, very high peaks around the new year. And one final comparison, this is Sunflower County compared to New York City. And so if you remember sort of the American coverage of the pandemic, there's a lot of attention paid to the New York metro area in April, and then things sort of improved dramatically there. But things got much worse by contrast in Sunflower County in the summer when case rates in New York and that area were basically zero. So I just want to highlight how much variation there is at a local level, both in sort of the impact of the pandemic, but also in the narratives that surround it. So the argument that I made in the original chapter was essentially that these blanket solutions, solutions over like a large kind of spatial area, are kind of developed using more privileged communities as reference points, so bigger cities with better infrastructure, and that the implementation of these blanket approaches in marginalized or disadvantaged communities runs the risk of widening social inequality. The conclusions of that chapter highlight the importance of engagement with grassroots voices, awareness of the structural disadvantages at play in local communities, and greater attention to the kind of the long-term effects of the pandemic. So for today's talk, I want to focus on how this has impacted public education in this community. So I wrote that chapter last summer when, again, when the pandemic was sort of at its first kind of peak. Um, and then, life went on, and the school district and this community had to figure out what to do about education as the pandemic was still raging. So the initial plan for this public school district, which again is very under-resourced and relatively poor, was to allow parents to choose between an online-only model or a hybrid model in which students would come to campus in person 2 days a week. However, the online model that they proposed was very punitive. These families, again, who are mostly very poor, would have to provide their own devices, and they would have no interaction with teachers at all. And so for parents who are worried about their children's health, this choice felt punishing. So over the summer, there were a series of protests in which parent groups, teacher groups, and student groups came together to advocate for an alternative approach that would take their children's health and well-being into consideration more explicitly. So this is a protest in a local park. Um, and this was sort of an exercise that the protesters did in which they took a rope that had 6-foot segments indicated, just to show how difficult it would be to take a classroom full of children and kind of create 6 feet sort of bubbles around each of them. And so the school district kind of reversed course and late in the summer announced that everybody would be doing this online only model, and they would provide technology with CARES Act funding. So the CARES Act and sort of associated legislation was the federal government's first response um, to the pandemic and provided a lot of funding for schools. The sort of catch here was that they ordered all these computers and Wi-Fi hotspots, but every school district was doing this, right? And so the technology didn't actually arrive until November. So um, until November, students had to either provide their own devices or were given sort of packets of worksheets to do instead. And it's currently, late April. These schools are planning to slowly transition to online learning in the next 2 weeks. So this was sort of the plan for most of this academic year. And so through the course of this year, I've been able to kind of work with a couple of students that I know from my field work. I gave them recorders so they could record their own observations without me having to be in their homes. Um, I maintained an active sort of text message correspondence with them. Also that I could kind of capture some of this data without having to, run the risk of exposing anyone to unnecessary risk. So this is a quote from one of the parents of those students, and she's talking here about the dissatisfaction that she already had with her schools. She had to do a lot of work to supplement their education with games and flashcards. Um, she wanted them to get more than they were going to get at their school. And the pandemic, of course, only made that worse. And so on the right, here's an image of a text message conversation I had with her son, kind of right after I asked him to start doing these recordings. And he told me, that he talked to his mom and it really hurts to see her cry because of all the strain she was under to provide even an adequate sort of basic education during this work. It wasn't all that stressful. So the same young man interviewed one of his cousins just to kind of get some practice with the recorder. And, this was when the Cardi B song WAP came out. And so they were kind of joking about that for a bit. Another young man who had one of these recorders wasn't able to get a computer. And so he had to do these packets of worksheets. Instead of having actual instruction, they would give him a bunch of worksheets stapled together every Monday. He had to complete them by Friday, and that was the extent of his education until early November. And here, he's kind of saying that he didn't like this at all, right? So he missed having the interaction with teachers, with friends, even over Zoom. It was better than sort of the complete isolation of having to be basically self-directed and homeschooled. Um, Another young man did some recordings of one of his classes for me, and this, is a field note from one of those recordings. I'm just going to summarize here. His English teacher wanted them to do a short exercise based on some work they were doing about inferences and use of evidence. So she tried to start a 2-minute video that they were going to analyze, but the video didn't work. As I'm sure we've all experienced, getting sort of video to play over Zoom is difficult, especially when the broadband infrastructure is already kind of underdeveloped. And so she gave up on the video after about 3 minutes, and instead was going to create a discussion post on Canvas, which is, a learning management system. And after another like 3 or 4 minutes, it became apparent that the students weren't seeing the discussion question. Um, and eventually, after almost 10 minutes of this, a third of their class time, she gave up and said, okay, we're just going to go on to class. And so this is a kind of very, small moment that shows how even in the best case where everybody has a device, um, students are not getting the learning that they sort of should have been. Um, and kind of finally, kind of zooming out a bit, I want to talk a bit about how this is impacting students as they plan for their future. So, I'm want to respect sort of the time limit, so I'm just going to kind of generally talk about this case. I've been working with a nonprofit in this county for about 3 years that does college prep and kind of career counseling. And I've worked closely with the high school seniors each year to help them with their college plans, making sure they get somewhere that works for them and is affordable. And last spring of 2020, this school system just abruptly closed down after spring break. So there was no online education, no worksheets. From May 2020 to June 2020, there was just nothing. And part of what that meant was that whatever grades students had when they went home for spring break were the grades that they were sort of stuck with through graduation. And so in the case of the seniors, that meant they couldn't really do anything to improve their GPA um, or anything else, right? So this was a kind of so I was in a Zoom sort of room with some of these high school seniors, and I had this conversation with one of them about sort of her kind of college options. And long story short, there's a pretty generous scholarship in the state of Mississippi for students who have at least a 20 on the ACT, which is one of our admissions tests, and a 2.5 GPA. She had the ACT score, but her GPA was at a 2.47 because of a problem she was having with the science class that semester. Um, and so, in a really uh, sort of painful sort of twist of fate, I guess, because of the pandemic, she wasn't able to pull that grade up, which meant that she missed out on nearly $80,000 of scholarship funding that would have made her college options much more affordable. Um, so a really small thing that's going to have impacts on her life, really for the rest of her working life. She had to go to a university that was not her top choice. Because of the pandemic, her fall semester was very stressful, and she ended up dropping out after failing all of her classes. And really, that's sort of a consequence that we can trace back to this one sort of decision by the school district to freeze her grades in place. Okay, so this is a very local, as I mentioned, case, kind of very small consequences and impacts that we're discussing. And I want to kind of zoom out and think about what this means for kind of larger conversations about the pandemic. We know there's an extensive literature in sociology about the role of education in reproducing class and racial disparities. Um, and then sort of regions where this educational infrastructure is already relatively weak, we know that this impact is going to be compounded by the disparate impact on students of color in these poor communities. And sort of a quick sort of thought or experiment or comparison, in the 1930s during the Jim Crow era, Black students would often only have maybe 4 to 5 months of school because they were expected to work in sort of agricultural fields the rest of the year. This past school year, because of these closures, that's basically what students had this year. They only had 4 to 5 months of actual school, almost 100 years later. And so, the pandemic isn't over. As sort of Michael discussed in his opening comments, we're still seeing very severe impacts, both health and otherwise, around the world. But even when it's over, even when the virus is contained, these impacts are going to linger for many, many decades. And we need to start sort of developing frameworks to understand that enduring impact now if we're going to sort of mitigate the worst of it. So I'm going to end my talk there, and I'll be happy to take questions and comments at the end of the segment.
Thank you for that, Ryan. One of the things I like best about your work, and I really am a big fan of it in general, is that it does take this local example, but I think it does a brilliant job of making a local case paradigmatic. So there are all kinds of lessons there, just even outside of the Sunflower area, right, that we can take about race and education and class and lots of issues. So while a local case study, I think it does really a brilliant job of elaborating these larger sociological issues. So thank you for sharing that. For our next presentation today, unfortunately, the presenters are ill. So they have submitted a video presentation. So I'm going to share that presentation with you now. I'm going to try to share that presentation with you now. I should put a qualifier on there. Here we go. I think this will work.
Hello, I'm Dr. Matthew Skinta, and I am happy to share the proceedings of the book chapter that I co-authored with my collaborators, Angela Sun and Daniel Ryu. Now, I'm going to be relatively speedy as I go through, given the time constraints, and my apologies for not being there in person. But I like to think about the impact of COVID-19, of the pandemic on queer and trans people, in three different categories. One is that there were sort of pre-existing conditions of bias in our cultures and societies that were magnified or brought under the magnifying lens a little bit of the media through responses to COVID. There were direct effects, ways that COVID just appeared to affect the community differently in ways because of these systemic sources of biases. And then there are ongoing and evolving experiences. We're still not done. We can't say that we know the full extent of how the pandemic has affected queer and trans communities. I look at this work typically through the lens of minority stress theory. This is the dominant lens in social and clinical psychology right now, which emphasizes that the various forms of bias related to sexual and gender minorities trickle down from society through those that are very internal, internalized homophobia, efforts at concealment, to stressors that are completely external, such as violence, discrimination, or other forms of stigma, as well as those intermediary roles like the awareness of rejection sensitivity that individuals carry with them, or sources of resilience, such as community connectedness. So these are some of the headlines I pulled within a couple weeks of the pandemic last year and the lockdowns starting. So you can see I threw in some examples that were just context for the time. The US House, Republicans were pressuring Amazon to sell books on gay conversion therapy. But meanwhile, rhetoric was boosting and discrimination or harassment of LGBT people specific to lockdown rules was happening from within the first week. In terms of social and religious animosity, religious leaders on most continents across all large global faiths were documented attributing the pandemic to LGBTQ people or to their rights. In many nations, in Turkey, leading imams posted these opinions that Erdogan and his close politicians repeated and retweeted. The same occurred with evangelical ministers in the US and top Republicans and Trump officials retweeting these views. Within the first days of the first lockdown, a gay couple in Marseille shared images of a threatening letter placed on their car blaming gay people for spreading COVID-19, just like we're known to spread HIV and that they should leave. In Morocco, it co-occurred with a wave of outings through Grindr that led to multiple men being kicked out of their homes during shelter in place, leading to at least one documented suicide, though of course rumors of others in April 2020. So individuals were being outed and forced onto the streets by their families right as shelter in place orders occurred. In South Korea, which had seemed to have the virus under close control at the beginning, had an early outbreak traced back to a gay club, which led to a wave of anti-gay sentiment. There was also an inspiration and an uptick in anti-LGBTQ violence that was seen. Panama, Peru, Bogota, Colombia, they all initiated strict quarantine rules that designated shopping days by gender. Women could shop Monday, men could shop Tuesday. This led to virtually immediate harassment of trans people, particularly trans women. Arrests, harassment by police, being jailed in closed quarters, which we know around the globe put people at great risk of contracting COVID. Ulysses Rocateri, a young gay artist and activist in Belize, was detained for allegedly breaking curfew and beaten severely. He died days later in the hospital, but not before reporting to journalists that he felt he was targeted and the police had beaten him related to his activism and not related to any rule violations. Ugandan police also attacked a shelter in Kampala, housing 23 queer and trans people for violating pandemic rules that had to do with how many people could stay under a roof, thereby rendering them homeless and pushing them out without shelter and at risk of arrest. We've also seen legal protections the globe over be chipped away at. This is something that was increased by some of the special powers that were granted in some governments. So for example, in Hungary, President Orban received powers to pass laws in sort of a streamlined way while Parliament couldn't meet. And so on his very first day with these powers, he passed rules that changed all government IDs so that it had to list the sex assigned at birth as opposed to a gender marker, meaning that individuals could essentially no longer change the sex on any of their government ID. They've passed a flurry of additional anti-LGBT laws since. Until his last day in office and throughout the pandemic, the Trump administration in the US was pushing for a rollback of healthcare protections for trans people specifically, but also just generally for medical providers to restrict or deny care to LGBTQ people. For those of you involved in trans health, you know of the Tavistock ruling in the UK that immediately halted puberty blockers and affirmative hormone therapy for youth under 16. I'm including some things like this because it's important to consider that that many attacks on LGBT people and our freedoms and experiences were occurring in a context where individuals' abilities to lobby, to protest, under the pandemic were severely limited. So you see examples like this around the globe. There were also heightened risk to people who were already vulnerable. So we know that queer and trans people are overrepresented among asylum seekers and refugees globally, who were often met with closed borders during this time. Migrant numbers have increased dramatically in recent years, with LGBTQ people overrepresented. And in some of the few places where you could cross a border, we know that in the US, for example, that individuals would then be placed immediately in immigration detention facilities that were pretty large outbreak centers for the pandemic. We also know that queer and trans people are overrepresented among homeless populations, that homeless shelters have historically rejected or turned away queer and trans people, especially trans people. This was exacerbated by shelter-in-place orders. When we think about barriers in healthcare, it's important to consider first that queer and trans people might be more vulnerable to the pandemic because we're a population that around the globe is more greatly affected by HIV, has higher rates of cigarette smoking, and in the US, lesser access to health insurance and healthcare because these are historically yoked to both employability and marriage. These concerns are all magnified among trans individuals where access to employment of a caliber that includes healthcare can be limited, and approval for gender-affirming procedures can already take years in the US, a great deal of psychological distress, And these procedures were canceled in the early days of the pandemic as elective, meaning many individuals may have been forced to restart these processes. The early months of the pandemic were also accompanied by medication shortages and perhaps even more impactful fears of medication shortages, which led to a limited access to appointments for gender-affirming hormones, as well as antiretroviral medications, reports around the globe of individuals who would receive 3 months of medication at a time, only receiving 1 month refills. I've heard anecdotally, even from colleagues who are living with HIV around the US, that in many parts of the US, telemedicine doesn't allow for prescribing or refilling prescriptions of antiretrovirals, meaning that someone who's potentially immunocompromised actually has to go in person during the pandemic to an ER in order to refill their prescriptions. There are recent findings that show that the pandemic's been experienced in different ways by LGBT people. So the Kaiser Family Foundation had found that a large percentage of LGBTQ people reported losing jobs due to COVID closures compared to cisgender heterosexual people. 3/4 of queer and trans people reported adverse mental health effects due to stress related to the pandemic, compared to just half of cis hetero respondents. And more than double the amount of those queer and trans respondents described the mental health impact as major. And while interest in vaccination is about equal, queer and trans people report a much greater emphasis, about 50%, on the idea that this is a shared responsibility to protect one another, versus only about 1 in 5 of cisgender heterosexual people who agree with that. The rest feeling that it's really a matter of personal choice. Queer and trans people in the UK were, during studies in this time, were more likely to live alone, heightening the impact of loneliness during the pandemic. And we know from other literature, this is likely true in a lot of wealthy countries. And the ongoing economic downturn is already showing signs of increasing bias and discrimination toward queer and trans people. There's been some evidence that unmarried queer and trans people are more likely to live in areas where having to work outside the home has been common throughout the pandemic, that many queer and trans people themselves are essential workers, particularly Black queer and trans people, and are unable to avoid work outside the home, which puts them at a greater risk of exposure to COVID-19. And there are some pockets where there are data, such as during the long burning outbreaks in Southern California, where there was strong data suggesting that queer and trans people of color were overrepresented among those contracting COVID-19. Hundreds of state and local laws restricting activities or mental care for trans youth have been occurring in the US since the start of the Biden administration. And sexual minority people have reported greater distress due to social distancing. Essentially, remember, I started with the idea of minority stress. We know that one of the strongest resilience factors for queer and trans people is community connection, then the isolation, loneliness, and disconnection from the community has been great. The inverse is also true, which is that there are accounts around the globe of individuals who have had to shelter with either anti-LGBT or violent families or households that put individuals under stress. So in conclusion, it's important to consider that queer and trans people may be both more vulnerable to and more distressed by the psychosocial challenges of life during the pandemic when compared to cisgender heterosexual people. Political and legal attacks against queer and trans people have occurred globally, and the joint pressures co-occurring with reduced contact with community or outlets for activism have likely further added stress. Border closures have slowed or halted asylum seeking in many parts of the world, leaving queer and trans people who have been planning or hoping to seek for safety unable to flee. And individuals sheltered with anti-LGBTQ families are similarly experiencing psychological stress and physical risk. So finally, it's important to consider that rights won in years prior to the pandemic may have been lost in many countries around the world or continue to be lost prior to the end of the pandemic. So LGBTQ people in many countries may face a very different world than they lived in once the world is completely reopened. I know this is a very brief synopsis, and I welcome any follow-up communications with questions that any of you might have. And thank you very much for allowing me to be a part of today.
Okay, I'm not the expert on that topic that Matthew is, but if there are any questions related to it during the discussion or question and answer, I'd be happy to try to field them as best I can. I'm thankful to Matthew for recording that video, even though he wasn't feeling well. I think it's very informative. So with that in mind, I'd like to turn it over to Kristen Desjarlais-deKlerk to talk to us about homelessness. Kristen?
Good morning, everyone. It is, sorry, I'm trying to share my screen. It's been a while since I've done this. I apologize in advance. Good morning, everyone. Good morning, good afternoon, and good night. It's great to have you all here. I'm Dr. Kristen Desjarlais-deKlerk. I live in Medicine Hat, which is a tiny city in Alberta. Its only real claim to fame is actually resolving homelessness, which I'm also happy to talk about later at the end of this talk. And I'm not even being terribly facetious there, but we can discuss that as well. That said, today I'm going to talk mostly about the chapter that I wrote for the collection. I have a slide where I'm talking a little bit about next steps and things that I'm doing now to try and understand ongoing responses to homelessness. But this work is really rooted in my experience as a former shelter worker, as well as a scholar who studies homelessness. So I think most of us in North America, I think the messaging was pretty clear across most of North America based on the media that I consumed when I undertook the study, when I took it on. The messaging about COVID-19 during wave 1 was stay home, stay safe. We were consistently told this. While Canada, and I'm focusing on Canada, that's where I'm from, we were seeing cases escalating, systems in some places of the country were becoming stretched, and there was a lot of concern about what the pandemic would mean going forward and how it would impact all of us long term. But the messaging about staying home was persistent and actually has been fairly persistent throughout the course of the pandemic, even as policy has changed and allowed us, depending on your province, to do different types of activity. We're continued to be encouraged to be at home. As a former homeless shelter worker and a researcher who often studies homelessness, I actually found this a little bit concerning and very troubling. Those who have never visited a homeless shelter or stayed in a homeless shelter, shelters are cramped. They aren't designed for distancing. Shelters essentially encourage people in a congregate situation to live on top of each other. If you've ever seen night at a shelter, predominantly the built form makes it so that the mats on which people sleep are like max of 6 inches apart. I was very concerned, and this distance was just not remotely acceptable from a COVID-19 public health perspective. So I wanted to understand how homeless organizations and homeless service organizations were responding to homelessness in light of COVID-19 and the public health crisis that we were experiencing. So my work and most of my academic work is really rooted in a social determinants of health perspective. And this, of course, is the argument that a myriad of social conditions essentially impact and change health. Health varies by social things, and sociologists have long argued this. This is not a new perspective. But in this particular case, I really restricted and spent my focus looking at housing and shelter living as an important social determinant of health. I think this is important partially because when we think about housing, it offers so much to us. It offers us safety, it offers us comfort, it protects us from the elements, it allows us space, it's typically better for our mental health. Housing is a very, very important component of our health and our ongoing mental and physical well-being. And because of this argument, we've actually seen housing first policy become rampant across North America. Housing first was first proposed by Sam Decemberis in the US. Essentially, it argues that housing itself is the primary solution to homelessness. And while I think this is not a particularly novel idea, in the past, a lot of the time, when I say in the past, I mean like pre-housing first, okay? In the past, a lot of the time, providers would almost make it sort of like this step incremental change that people would experience in order to achieve their own apartment. So you had to deal with a bunch of other issues, whether that's, substance abuse issues, whether that's mental health issues. It was just this sort of incremental version. The argument with housing first, however, is once you're in housing, you have the stability in order to deal with everything else, in order to make other life changes. Of note, housing first has become pretty popular as a policy across Canada, especially as we've seen increases in 10-year plans to end homelessness. And in fact, it is, I would argue, the predominant social policy and homeless service organization policy in Canada right now. So to answer my research question, I decided to focus on media, specifically news media and reporting on the responses to homelessness during wave 1 of COVID-19. And there were a few reasons for this. First of all, homeless populations are not necessarily the easiest to access from like a ethics standpoint. They're not the easiest to access necessarily if you don't already have close contacts. And I pragmatically live in a city where our homeless population is very, very small. And so I made the decision to focus on media to see what the responses were and what the range of responses were. This allowed me to move fairly quickly, but it does have some limitations that I can talk about later. I confined the sample to Canada and Canadian news sources pragmatically. Originally, I was looking across the globe and there was just too much to consume. And so I focused instead on 3 major Canadian cities and their responses, Toronto, Calgary, and Vancouver. This is partially because all 3 have purported to have adopted housing first as a policy. It doesn't always work that way. Again, a discussion for later if people are interested. This is by no means a representative sample. I looked and found as much as I could. I explored tweets as well by prominent figures in homelessness communities in all 3 cities. So I'm going to talk a little bit about the results now. Toronto shelters, it's important to note, have been overcrowded for years. This is not new. Toronto shelters have needed more housing and a better, more robust response to homelessness. They also are a very population dense city, which traditionally doesn't respond as quickly to homelessness. They were seeing roughly 7,000 people daily in their shelter system and another approximate 1,700 people rough sleeping. Rough sleeping means they're sleeping outside in whatever capacity. When we say approximately 1,700, this is actually like the number is likely higher than this. This is based on a pit count, point in time count, where homeless researchers and advocates go and literally count people they find on the street in one evening. COVID reduced shelter use and increased rough sleeping. And this was an identified problem in the Toronto community, especially as March and April are not months that are typically very warm in Toronto. So the temperature was fluctuating substantially during these months, and there were very reasonable concerns that people were going to freeze outdoors. It's also important to note that because shelters were already overcrowded, the spacing was incredibly troublesome, to the point where in early April, a lawsuit was launched against the city of Toronto, who was responsible for mitigating the shelter response. And advocates were arguing that the city had not adequately accommodated people to be able to distance. By mid-April, however, the city had secured 1,200 hotel rooms and committed to ensuring that people were moved into housing. The lawsuit was dropped following this. However, yeah, there was still a lot of people that were in less than ideal spaces, and they were electing to sleep outdoors still, based on my reading. In addition, they moved over 2,400 people into housing during that time. All right, so let's talk Calgary. So Calgary was pretty quick to respond in terms of their shelters. They have 3 major shelters and a bunch of little ones. They reduced each of their capacities by approximately a third. The largest one went from 675 beds down to 227, and they opened a shelter in an event center. They also opened shelters in various churches and basically anywhere that they could find additional space, so they could essentially allow for 6 feet between people at all times. Much like Toronto, they saw more rough sleepers and people just electing to opt out. So they were making the choice not to be in the shelters because there was concern about getting sick. The city actually offered to second hotel rooms because there were so many empty hotels, but the system in Calgary is very different than the system in Toronto. And essentially nonprofits and nonprofit orgs are the kind of central delivery system of service in Calgary. And those providers actually declined. And they declined for a series of reasons. One of them was talking about bed bugs in the news. Others, however, talked about suicide and mental health risks. City advocates highlighted trouble with closing public spaces. And in fact, there was reporting on people not being able to access washrooms, right? When you close down downtown public spaces, where do people go during the day? A lot of shelters don't actually have day space. And in fact, there was a move to create day shelter because it just didn't exist before. They also enacted isolation hotels, much like we saw in Toronto, where people who have symptoms or test positive for COVID-19 can stay in them. And the last one, Vancouver. Vancouver is, okay. Vancouver set out actually to close encampments just as all of this was going on. So from what I've read, it seems to suggest that some of the desire to close encampments has been ongoing for a very long time. However, the city decided that it was imminently important because they thought these would be like hotbeds for pandemic, right? Hotbeds for illness to breed and grow and essentially transmit. So they planned to move residents into temporary housing during this, both apartment and hotel accommodations, but that plan actually was not very effective, and many former encampment residents really had nowhere to go. A lot of them, homeless populations are very transient. A lot of them ended up on some of the smaller islands in BC, like Salt Spring, etc. Shelters remained open, and there were no new intakes, however, which meant that if you didn't already have a spot at a shelter, you were out of luck. And actually a lot of meal programs ceased, like they just stopped operating. So finding service became very, very challenging in Vancouver. And this, of course, has major fallout now, today. And I can talk about that a little later. So limitations. So there's obviously some big limitations here. First of all, I really did focus on major news outlets. I would have loved to talk to both service providers and shelter residents, but this was just not really that possible in the middle of this crisis, especially during wave 1, as everyone was trying to be very dexterous. What I think is also important, however, is wave 1 is very different than waves 2 and 3. And I was always kind of cautious to talk about wave 1 versus what was coming down the pipe. And the thing about North American climate, and I think most of us are aware, COVID seems to be worse in the months when respiratory illness seems to be worse. And when I was writing this, it had not entered that season. I'm happy to talk more about that, but currently my work and my ideas are I'm investigating how waves 2 and 3 have gone with all of these cities. And I'm finding Vancouver in particular interesting, perplexing, and concerning, especially around overdose. That said, I have some theories about wave 1 responses versus wave 2 and 3 responses and how these influence each other. A good, robust response in wave 1 actually, I suspect, may reduce your response later. And we can explore that more in the discussion if people would like to. So in terms of COVID-19 homelessness and risk, I suspect politics are a really important social determinant of health that continues to impact those in homelessness and poverty in really expansive ways. The politics of homelessness, combined with who actually has to give and is mandated that response, is going to have huge influences on how people respond to homelessness in a crisis. And donor relations and funders seem to have a big influence on who navigates the response and how well they do it. All right, so in conclusion, I think we're all aware COVID-19 has exposed some pretty big systemic vulnerabilities. For a very long time, homelessness scholars, well beyond my time, have argued that the solution to homelessness is housing. And I suspect we're in a time when it's becoming increasingly clear that the vulnerabilities of those who don't have a house need to be better resolved by systems that allow them to do so. I thank you for having me today. I have lots more I can talk about if people have questions, and I look forward to some lively discussion. Thank you.
Thank you, Kristen, for that, not just for the presentation, but for drawing attention to this really important issue. I really haven't found a lot on COVID and homelessness. I think there's been a little bit more maybe in recent months, but from what I've read, and even if you weren't sitting here, I would say this, by the way, yours has been the best. And I think a part of that is that it's very clear that you have a heart in the matter. And I think that's important in scholarship in general, but particularly with an issue like this. So thank you for sharing your research and your insights with us today. I now want to open it up for discussion. So if anyone has any questions, let me just make sure I've got the chat up. Yep, you should be able to type it into the chat, or if you'd like to raise your hand, we can start with some questions. Actually, just disabled the chat. I hope it's working. Should be, yes. Well, while folks are thinking, let me throw one out there for both Ryan and Kristen. And I'm wondering if you guys think, if you have thoughts about lessons that might have been learned. I know human beings are often slow to get lessons from crisis because it's over and we forget everything that happened. But if you think there's any lessons that have been learned, and if you think anything might change in a post-pandemic world, or if we'll kind of go back to the way it's always been, if you have any thoughts on that.
Yeah, I'd be happy to start. I mean, so I was, talking about a very rigid bureaucratic system, public education, that has a very sort of precise set of expectations about testing, about like how many days a student should be in class in a given year. And that rigidity has been sort of a major source of the problems I was talking about. So, ideally, the lesson we learn is that we need to be more flexible with different institutions, particularly with regards to institutions that produce stratification and inequality. I don't think we're likely to see much change, at least in the American context. We have a very strong sense of what accountability in education should look like, and I don't see that changing. So that would be my hope, is that we sort of recalibrate our expectations for how institutions work and incorporate a greater sense of flexibility and even grace into how those things work.
I think one of the big lessons for those who serve homeless individuals is access and accessibility. So while it didn't make it into my presentation, there's a publication out of U of T this last year. I want to say it was circa 2021, January, that talked about the mortality rate for those experiencing homelessness versus the general Canadian population. And it was roughly 5 times, which is kind of obscene, but part of it is also just access and access to healthcare, having healthcare needs taken seriously. This is an ongoing problem for people experiencing homelessness. When they go to hospital, when they go to an emergency room, often their concerns are written off as merely seeking substances, which I don't think is fair, and also just wholly inaccurate, because if you're treated that way, you're not going to go to hospital. Like, in my experience, it has to be really bad for one of my former clients to visit a hospital. So I would hope the system is recognizing these problems. I know that there's been systemic inquiries into some of these things, whether that'll result in new training for physicians and nurses triaging patients. I don't know. I like to think that these things are dexterous and malleable, and we are seeing some changes. So there's a lot of critique on the Canadian healthcare system about racism right now, especially towards Indigenous people, as there have been some very well documented cases in the last year. I suspect that there's going to be more of that ongoing in terms of training. And so my fingers are crossed. Am I hopeful? Yes. Am I skeptical? Always. So we'll see. I saw a question in the chat about terminology and rough sleeping. So rough sleeping is essentially anywhere that is not like a shelter. Okay, so or it's not a house, it's not a shelter, it's outside. It can be camping, it can be sleeping under bridges, it can be finding like way back when I used to do outreach 15, 20 years ago almost. I remember walking through like little community parks into these almost impossible to find encampments that we knew they were there. And we would bring socks and food and water. And so rough sleeping, I mean, it sounds like it's really kind of barren, but people can create entire communities in these little tent cities. And it's not necessarily a real tent city like we would think about, because it's not easily findable. You have to know what you're looking for in order to find them. So it covers all of that. That rough sleeping is kind of a catch-all term for all of these people that just don't sleep in a house, don't sleep in a shelter. I hope that helps.
I think Sarah also had a question for you, Kristen, about if you could talk more about how the approaches to waves 1, 2, and 3 are connected and different.
Okay, so I'm still just in the rudimentary phases of looking at 2 and 3. I teach at a community college, and so my load is 10 courses a year. So right now I'm just coming out of that. So I apologize that I don't have more for you at this point. But I've been talking to a lot of service providers as my semester's coming to an end, and starting to read more news media again. And one of the things that's really, really clear in Vancouver and Vancouver Island and sort of the entire BC area is that homeless populations actually aren't really getting COVID there. And I know this sounds really, really strange, but the COVID rates are way lower than we've seen in the rest of the country. And part of this is because in the warmer climates, instead of keeping shelters open, they just shut them right down. And so we've seen some of these communities turn entirely into encampments and tent cities, which I think we're aware COVID spreads less outdoors, so the risk is way lower. They also aren't really in contact with people the way they are at other shelters, because they're not seeing workers, they're not seeing volunteers, they're not interacting with a lot of people. So it's almost like this little closed-knit community. What the real problem is, however, is fentanyl. And there have been just these massive increases in overdoses across all of BC. And part of that, I mean, we can talk drugs at length. Part of it is supply lines to the US. So, getting narcotics in is harder than it used to be. Fentanyl gives you a pretty good high for cheap. And so your dealer doesn't really care if you overdose, except he makes less money. And I mean, safe supply in wave 1 was kind of revolutionary and incredible. That was something that Vancouver was purporting to do, was to actually give people like prescription level narcotics, give active users prescription level narcotics because safe consumption site had to shut down, right? So a safe use site, somewhere where they supervise people while they use, was no longer viable, and you couldn't really use with a buddy, which is essentially like the overdose strategy, right? If you use with someone else, you're less likely to overdose because you have someone to watch you and give you naloxone if you should need it. So in terms of connectedness between these three, I think actually a strong, robust system to response to wave one means that you're kind of cocky when it comes to waves 2 and 3. And when you've done well, you think it was unnecessary, right? And because like wave 1, COVID, in terms of the homeless population, was not much of an event. A lot of people didn't get very sick. They were kind of okay. Bear in mind, COVID came to most of Canada February, March, April are kind of the months when we started to see cases. And then things just started dropping pretty quickly. And so they were like, oh, we did really well, and give ourselves a pat on the back. But it means that your response to wave 1, when it's successful, means you don't think it was necessary. And this is what the like overarching kind of narrative in the news seems to be, is, you know, we did so well with wave 1, we shut everything down. Obviously, more of a response isn't necessary. And that's, or it was too much. Our original response was too much, which I think is one of the biggest problems that Canada is facing right now. Is there's almost this really, I live in Alberta, so I live in like one of the most divisive COVID provinces. Roughly 40% say our current measures are too much, and 40% say it's not enough, and then like the rest, which is like 7-ish%, think that this is perfect, like what we're doing right now. And we're shut down again, just so people know, shut down. We have some restrictions. We've never had a full shutdown since last year. So I think these things, I mean, it has influence, and I'm working through these ideas and trying to make sense of them. And it's still early in that process. Thank you for the question.
Thank you for the answer. I think we're right up to time for this session, but there is one more question that I think is a good one, so I'd like to get it in, and maybe we can just give a quick answer here. But Alejandro has said, I love the 3 presentations, thank you. I would like to ask presenters, if they had full power to change a public policy to address the issues they discussed, what change would they prioritize? They've already raised some points, but wondering if there is any additional one-off change they think will make a big difference. So maybe just a quick insight into that.
Yeah, just if I had unlimited power, I would just do over the school year. And you know, that's not going to happen, but I think thinking about what that would mean would be really helpful in understanding like why we have our education system, why it's structured the way it is, and hopefully move us towards a more equitable both system and response.
For me, I mean, I think from my presentation, I think housing is essentially like, it's so important, and supporting people and ensuring that they have access to that. That said, I also don't think you can force people into housing. And so there's this, you know, this zone of like, it needs to be available, but also just an option. And I would guess that is one of the most protective factors we could have had during this past year in Canada, partially because of our harsh climate. So if you're choosing to rough sleep, if you're choosing to sleep outside because you don't want to get sick, housing is absolutely a good solution.
Both good answers. If only we had a magic genie, we could make that happen. But we do have people such as yourselves who are activists, who are doing scholarship on this, who are making these issues available. So in that sense, it's even better than a magic genie. So thank you again for your presentations and for the work you've done, for the work you're doing. Thank you to the audience for the good questions. And we're going to take a quick, looks like about a 10-13 minute break now, and we'll come back with our next session where we're going to talk about psychological impacts of the pandemic. So something we've all no doubt been facing. So I will hopefully see you all in about 10 or 13 minutes or so. Thank you.